want you to imagine this. You wake up one day and there is a stranger right beside you. Her clothes look familiar and you are sure that you have seen that hairstyle before. You try to get closer and discover that she even wears your wife's perfume. You rub your eyes and you run straight to the mirror, and to your surprise, you cannot even recognize your own face. What should you do next? Choice number 1. You call the police as there is an intruder dressed up as your wife in your house. Choice number 2. Schedule an appointment with your eye doctor. Choice number 3. Go back to sleep as you probably are just dreaming. Or choice number 4. You call 911 as you may be experiencing face blindness. And face blindness may be a sign that you are having a stroke. Yes, this may all be too shocking for you, but it's true. Face blindness may be the initial sign of a stroke. Good morning, good afternoon, and good evening. I am Dr. Hanz Bustamante. I am a board-certified internal medicine physician, and I want to welcome you to my brand new YouTube channel where we 10x your success by optimizing your health. Today, we will be talking about face blindness, otherwise known as prosopagnosia. If you have seen movies like Fight Club,
Second rule of Fight Club is
Ocean's 11,
Guys, what's the first lesson in poker?
An Interview with a Vampire,
How do we seem to you?
you probably know Brad Pitt and his struggles with recognizing people's faces. He admitted this in an interview he gave in 2013
I see your mouth moving, but it's great to
and again in 2022.
keep this one humble.
In that latter interview, he said that he was never formally diagnosed with this condition, and he admitted that his prosopagnosia was so severe that he often isolated himself from other people, preferring just to stay at home. In fact, if you do a Google search, you will find out that other famous people may be afflicted with this condition, with legendary primatologist Jane Goodall, Apple co-founder Steve Wozniak, and English actor and comedian Stephen Fry topping the list. The word prosopagnosia comes from the Greek word prosopon, meaning face, and agnosia, meaning knowledge. Prosopagnosia or face blindness is a condition characterized by difficulty and inability to recognize familiar faces, even when a person has normal vision and intelligence. Individuals with prosopagnosia may struggle to identify faces of family members, of friends, and even their own faces on the mirror. This condition may range from mild to severe to the extent that a person can no longer recognize a face at all. Prosopagnosia isn't just about facial blindness. Some people with this condition may have trouble recognizing and interpreting facial expressions too. A person who has this condition will have trouble recognizing people he or she already knows, especially if the cues he or she recognizes on that person is changed, like a new hair color, for example. What are the causes of face blindness? In theory, anything that damages the area of the brain in the mesial occipital region can cause this condition. This area is located in the back part of the brain, and it is concerned with putting visual signals together. Factors that affect this part of the brain include strokes, traumatic brain injury, and other degenerative diseases. Sometimes, this condition may be present at birth, and in fact, the National Institute of Neurological Disorders and Stroke, or the NINDS, states that some degree of prosopagnosia may be present in children with autism and Asperger's syndrome, and this may be one of the causes of delayed social development in this age group. And now, we come back to the question of the day. What do you do if you suddenly experience face blindness? If you answered call 911 for a visit to the hospital, You are absolutely correct, and you may have prevented permanent damage from a potential stroke. It is also critically important to know the more common signs of stroke, as published by the American Stroke Association with the acronym FAST, or Fast Warning Signs. We can use the letters in FAST to spot a potential stroke. F is for face drooping. Does one side of the face droop, or is it numb? Ask the person to smile. Is the person's smile uneven? A is for arm, or arm weakness. Is one of the arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? S is for speech difficulty. Is the speech slurred? And T is for time. And it's time to call 911 for an emergency just as this. So call 911 immediately as soon as the symptoms appear. Other stroke symptoms include sudden numbness or weakness of the face, arm, or leg, especially if it's one side of the body. Confusion, trouble speaking or understanding speech, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance or coordination, and severe headache without a known cause. And always remember this: the sooner you seek competent medical advice, the better it is for you. This may save your life or the life of a friend or family member. Again, this is Dr. Hanz Bustamante, MD, welcoming you to my brand new YouTube channel where we 10x your success by optimizing your health. And remember, a man with health has a lot of wishes, but a man who is sick has only one wish, and that is to regain his health. Please like, subscribe, and don't forget to hit that notification bell to be constantly updated on several life-changing health advice available here at the H Factor.